Imagine a situation when you're ill and you go to a doctor, say for a possible UTI, urinary tract infection. He jots down a list of antibiotics that you should be taking. You buy them, you consume them, but they don't work. You're helpless without any medicine for an infection that you have to probably live with for a couple of days. That, ladies and gentlemen, is the problem with antibiotic resistance. A situation where existing medicines are no longer effective in treating infections in our bodies. That is turning into a reality. Common diseases like UTIs, blood infections, pneumonia and typhoid are becoming harder to treat because the bacteria causing them are no longer responding to common antibiotics. Precisely one of the reasons why over 39 million people worldwide could die from antibiotic-resistant infections in the next 25 years, according to a study that has been published in The Lancet. The Indian Council of Medical Research's Antimicrobial Resistance Surveillance Network released a report on commonly used antibiotics. It focused on treatments for infections like pneumonia, sepsis, respiratory infections and diarrhea.
I would agree with this study because it's our normal experience while treating them that the antibiotics that we used earlier, they are not healing or treating these infections anymore. And we have to use much higher antibiotics and for a longer duration of time to get a response in these infections.
The report tested antibiotics against bacteria, common ones such as E. coli, Klebsiella pneumoniae, Pseudomonas aeruginosa, and Staphylococcus aureus. These bacteria were found in samples from various parts of the body, including blood, urine, respiratory tract and infections. Her report findings are based on data collected from hospitals and clinics across India, covering both outpatients and intensive care units, ICUs, between January 2023 to December 31st, 2023, last year. A total of 99,492 samples were analyzed from both public and private healthcare centers. This report highlighted that E. coli, a common bacteria responsible for many infections, is becoming increasingly resistant to antibiotics. This is a concern, especially in intensive care units. Patients are critically ill as well as in outpatient settings, where people receive treatment without being admitted to the hospital. This resistance makes it harder to treat infections effectively. Many antibiotics such as cefotaxime, ceftaroxime, ciprofloxacin, and levofloxacin showed less than 20% effectiveness against E. coli. Similarly, Klebsiella pneumoniae and Pseudomonas aeruginosa are becoming more resistant, especially to key antibiotics that usually would work against them. Even widely used antibiotics like amikacin and meropenem are losing their power to treat infections effectively. Gram-negative bacteria, which causes infections in various parts of the body, are the most commonly found germs in samples like blood, urine and lungs. ICMR researchers discovered that bacteria causing gastroenteritis such as Salmonella typhi have developed over 95% resistance to the medicine that they were previously effective against. The antibiotic is commonly used for severe infections. The report emphasizes the urgent need for stricter control over antibiotic use. It highlights that misuse of antibiotics in agriculture and also in poultry is worsening the resistance problem. For example, all of us are having poultry which has been injected with antibiotics. That is a huge problem. A previous survey by the National Center for Disease Control has found that nearly half of the antibiotics prescribed in India contribute to antimicrobial resistance, or AMR. The situation, as described by the World Health Organization, is rather worrying. It's alarming, given that doctors are prescribing antibiotics left, right and center. Often, patients are not questioning the doctors the need to prescribe antibiotics, like it was done during COVID-19, which was essentially a virus. But antibiotics were given to patients. Also, over-the-use counter sale of antibiotics is a huge concern and a huge problem.
For more informative videos like this, keep watching India Today Newsmo.